Okay. You're live.
Right, excellent. Well, good evening, everyone. This is May 7th at 5 o'clock. This is the Town of Auburn, the Board of Health meeting, and I would like to call that meeting to order. Just one quick announcement. This is being, given the current state of affairs in the country and across the world, this is being done by remote access. And if you look at the agenda, top of the agenda, there is a join by phone line, and it's 1-646-749-3112. There also is an option that you can join by computer, and that's also by typing in the website in the join ID that you can see on our screen on the agenda. That is for the general public if they wish to ask any questions of the board. Moving down the agenda, we're going to remove a few items, and that was the reorganization of the board. I think we have that slated until the 2nd of July, after July 1st of the fiscal year, just because of the board attendance and stuff. We had to keep pushing that off. And then approval of the minutes. I believe we're going to hold on that one. Am I correct?
That's correct. Yep, we'll have those for the next meeting.
Okay. All right, so we'll take care of that, and then we will move into other, I guess, why don't we start first with the discussion of the single-use plastic bag reduction bylaw, and you can just do a quick brief on that, and then we'll get into the COVID stuff.
Sure. So as you may recall, the plastic bag reduction bylaw, which was passed at town meeting, did go through the AG's office and was approved and was slated to start to be in place 6 months after town approval. With the COVID emergency at the state level, they did have an order that came out, I believe it was the end of March, so March 25th. And as part of that order, they identified that essential stores, this was an order that actually had identified grocery stores, pharmacies. They were all essential services. They identified a lot of precautions that those facilities had to take in order to prevent COVID. So it revolved mostly around those type of stores. And they also identified in that order that grocery stores and pharmacies, food banks, emergency food programs, including those currently subject to municipal ordinances or regulations banning single-use plastic bags, may choose to use recycler paper bags, compostable plastic bags, or single-use plastic bags. They did not, at that time, they felt that to cut down on the possible transmission of the virus, that they did not want people bringing in reusable bags. As you may recall, a lot of the discussion around the plastic bag ban, we were actually encouraging people to use reusable bags. Because of the detriment to the environment for single-use plastic bags. So right now, due to COVID, that is actually on hold, and because of the bylaw that was supposed to be enacted, what I would like to suggest to the board, that we make a suggestion to the Board of Selectmen, since we are going to be the enforcing authority, that we hold on enforcement of the plastic bag reduction bylaw until at least we figure out what's going on. I'm not sure at the state level if they're going to take action on any of these bylaws, but we know at least for COVID, for the current emergency, it's on hold. I think it's reasonable to say, if you want to wait until January of next year. If we were to say about 6 months, it would bring us into the November, December timeframe, and that's typically a very busy time of the year for us because of the whole renewal process, so we wouldn't want to be starting at that point. So January, I think, is probably a reasonable time for a delay, but obviously, I defer to the board.
Okay. I think with hearing what you had said and everything that's going on in the government's, recommendation and stuff, I think I'd entertain a motion that we withhold on the plastic bag reduction bylaw and make a recommendation to the Board of Selectmen that they do the same until at least January of 2020 and await further guidance from the state. Is there a second?
Yes, I'd like to make a motion to delay the single-use plastic bag reduction bylaw until, make a recommendation to delay that till at least January of 2021, make that recommendation to the Board of Selectmen.
And if I could just jump in here, just for the purposes, if whoever is speaking, if you can just, Carolyn, if you can just identify yourself.
Oh, I'm sorry.
For the
This is
minutes.
Carolyn Griffin, the chair of the Board of Health for the town of Auburn, making a motion to
Thank you.
make that recommendation.
Okay, Ms. Eric Otteson, I'm the chairman. I'll second that motion. All those in favor of the motion signify by saying aye, raising your hand.
Aye.
Any opposed? There are none opposed. The ayes have it. Vote is nothing, so that passes.
Thank you.
All right, moving else on the agenda. I think we have a lot of stuff under COVID, and I think if we could go forth with, I think the first one is we have, actually, Darlene, I'll hand that over to you if you want to go across that.
Sure. So wanted to just kind of bring you up to date as to just the activities going on regarding COVID. As you know, the state updates their weekly cases for the cities and towns for COVID cases, and they typically do that once a week. They do that on Wednesdays. Yesterday, we did have a report out. Our current positive cases are 152 cases for positive COVID, and unfortunately, we do have 6 deaths. That is an increase from last week, where we had 55 positive cases and 1 death. We do know that across the state, testing has been increasing, so we do know that as more testing is done, we expect that the testing will reflect positive cases. So we are watching that, and we certainly field calls all the time regarding COVID orders, things from the state, all the guidance documents, and handling that information. I can tell you that we are in contact with the State Department of Public Health on a daily basis, pretty much, to address concerns about cases and following contact tracing, isolation and quarantine requirements, and so forth. So I just wanted to report that out for the board. We also, I did want to just identify the town administration, excuse me, had put into place the Auburn Cares program. And there's 2 parts of that Auburn Cares program. So we do have, we've got a hotline that residents call into. That hotline is 508-832-7720. Again, 508-832-7720. And they have been fielding calls from many different residents in town. We've gotten many calls from seniors, looking for resources. They also handle calls regarding people that may be in need of meals, and so there's a meals program going on at the schools as well. So that line has been pretty active, and we're able to take calls, and sometimes the calls come to us and we have to figure out who to refer to. So that program's been going really well and has been very positive.
Thank you.
Also, to just move on to, for PPE supplies, I wanted to just let the board know that we were fortunate to get a recent order of PPE for the Board of Health that the state had come out over the weekend. So we were really fortunate to get that, and I know we've been in contact with the state. They are trying their best to try to get PPE out to us, and we're seeing definitely getting a little bit easier on that end, at least what we're seeing. And if I can also just let you know, we have seen from recent orders at the state level. So I think the most recent order that went into effect yesterday for face coverings, we've already received a ton of calls on it, and we have had inspections increased for relating to those calls, also identifying businesses that may need assistance and guidance on the orders. We've been doing that right along, but the inspections are done with businesses on a daily basis, several times a day, and we're fielding calls, a lot of calls on the recent orders. The face covering order definitely, since it has gone into effect yesterday, people are just trying to, make sure they understand what's required and how that affects our businesses that we license.
Excellent. And I know that in correspondence with yourself through email and in town administration, I know the police chief he, is also there to help to assist you folks if needed to support you guys in any way. So I want to publicly thank him and his department members for offering to do that as well, because certainly they're more versed in enforcement, and we appreciate their assistance. Now, to that end, do we need a vote, or you're suffice to say that we already have the power and authority to do that, the fine of $300?
Right, and definitely I agree. The order, I know there has been some questions regarding the order as far as how this order is put into effect. It did go into effect yesterday, but there is an enforcement part of it, actually the end part of the order, and I think we're fine with it. The way that it reads, Department of Public Health, local boards of health, and authorized agents pursuant to Mass General Law, Chapter 111, Section 30, are authorized to enforce this order, and if necessary, may do so with the assistance of state or municipal police, which I think goes to your, obviously with the Auburn police helping us, that's a huge help for us. It further says violation of terms of this order or Department of Public Health guidance may result in a civil fine of up to $300 per violation in the manner provided for non-criminal disposition of violations of the municipal bylaw, ordinance, rule, or regulation pursuant to Mass General Law, Chapter 40, Section 21D, which is the ticketing reference. So I think it outlines it in here. The civil fine is up to $300. You know, I can tell you the every order does have an enforcement provision in it, but our goal is to not have to write a ticket unless we absolutely have to. You know, we certainly want to be able to work with the public. We understand that this is a difficult time. This the idea of this order is to help prevent the spread of the virus. So that's our first goal. I think the violation provision is in place if we have difficulty enforcing it. So if the board is comfortable with that language in the order, I don't think we need to take any further action. If we can obviously use judgment to utilize that provision.
Excellent. Okay, thanks.
And I wanted to just have, as part of the Maven updates, Eileen has spent a lot of time on this piece with State Department of Public Health, and Maven is the virtual network that we're able to basically get information regarding COVID and send information back. So it's an information sharing that is completely confidential. She is in constant contact with the state, and I just wanted her to identify some of the things that she is working with on Maven.
Sure. While you get Eileen, this is the program that we have access to minute by minute at the Board of Health, and we employ a public health nurse for the town. And this is something that we have surveillance on, and it's very important to note all infectious diseases, not just COVID, all. So measles, mumps, rubella, chickenpox, Lyme, or ehrlichiosis, there's a ton of them. So this is something that, and I know that there was talk about this initially about, why isn't the town doing this? Why isn't the town doing that? The town is doing it, and it always has done this in the past. And when we talk about the system in place, it's this system called Maven is what we're talking about now. So if anyone's tuning in, when we talk about it, we view these case reports, know that every day we have someone that looks at this, and it is followed by a public health nurse. And it's not COVID specific. This has been going on for many years as well. So Eileen, I'll turn this over to you now.
Thank you, Eric. Can you hear me? Can you hear me? Can you hear Erica? Eric, can you hear Eileen?
No.
Okay, just give us 1 second.
Hi, Eric, can you hear me now?
Yeah, we got you now, thanks.
Okay, so for the Maven system that we're working in, you're correct, Eric, we do get every infectious disease over it. Currently, right now, a majority of our cases we're working are COVID. We're fortunate enough to have the school nurses work with us, and we're doing our community tracing through this. So as all the confirmed cases come in, we're calling them and all of their contacts. The state put out a great community tracing program that we are able to use if we need to, but currently right now, we're able to call all of our contacts in our community, work with them for the guidelines the state put out for quarantine, for isolation, as well as make sure that they're okay in their home and what they need for services that the town may offer, which is what Darlene brought up, the Auburn Cares. There's many programs out there for those that are quarantined that we work with them to see what their needs are. Very receptive people in the community when we call, and we're able to help a lot of people. The numbers are kept on a daily basis, on a weekly basis, and the state reports them out. So any of the numbers that we have in our town can be found on mass.gov as part of the dashboard and as part of the state numbers that they report each day. So our community and our residents can find that information there. And I think that's it, unless you have any questions, Eric or Carolyn.
No, not at all. I just wanted to get that piece out there that, there's a system in place. It's always been in place, and it is very encompassing and surveils all of the diseases across the infectious disease spectrum. So thank you and I know that you have, you folks have access to that, and especially thanks to the school nurses who are helping us and helping, more importantly, you folks who are just being overrun and overworked in that office. I really appreciate the school department's help and also the school nurses with working with you guys with that. It certainly is a great service. So
Great, that's appreciated, and I'm sure they appreciate it. They're a lot of help. Thank you.
Yeah, no, I definitely appreciate that. So, okay, so, Darlene, I think we have everything on the agenda that was under the COVID section. Yeah, so I think that...
I think we do, unless, do you have any questions for me?
I don't. Carolyn, do you have anything?
No, I don't, actually. You answered everything. Thank you.
I don't know if you want to see if there's any calls from the public. We haven't
Sure.
we haven't had any call-ins, but just to give the option.
Yeah, sure. We'll hold for a couple minutes here and see if we get any calls in for the public. And while we're waiting, so if anyone in the public is watching this meeting, please do so now. If you have any questions or concerns, we'll hold here for a little bit to hear from you if you do. While you're saying that, again, I just wanted to reach out again and thank the other town boards, police department, the school department, school nurses for assisting the public health in doing this. And for those citizens in town, know that the Board of Health is very well served with Darlene, Eileen, Jordan, all you folks that are working so hard. Paula Conway as well, working everybody super hard up there, fielding complaints and calls, and this is really kind of turn your world upside down. And but again, this is the Board of Health. This is what you folks do, and you're doing a phenomenal job at that. And citizens of the town are very well served for that. So, and I'm sure Carolyn will agree with me. Thank you very much for doing that.
Absolutely.
Thank you. Yeah, we also want to let you know, we have, obviously, town government is an essential service, and we are practicing, we're practicing a lot in our office. We've actually enacted people to make sure that they can come in each day and make sure they're feeling well. We have people, wearing masks. We're all cognizant of social distancing. So we're really trying to, nothing about it is normal, but we're trying to at least make sure we're doing a good job of keeping everybody well here. We've been very fortunate, so we're going to keep doing that, and just wanted to let you know that it's a different kind of office space, but we're doing it, and it's going well.
Excellent. All right. Well, thank you very much. I don't see anyone else calling in. I don't see any other people who have called in, who have joined by computer. So I think I entertain a motion to adjourn.
Yes, I'd like to make a motion to adjourn today's meeting, May 7, 2020.
All right. And I will second that. All those in favor?
Aye.
Aye. That is it. Meeting is now adjourned. Thank you, everybody.
Thank you very much.
you.
Stay well.